For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good afternoon. My name is David Campos. I'm a Deputy County Executive for the County of Santa Clara and Lead Public Information Officer for the County of Santa Clara's Emergency Operations Center. Today we will be hearing from first our Public Health Officer, Dr. Sarah Cody, and then from our COVID-19 Testing Officer, Dr. Marty Fenstersheib. And these two doctors are here specifically to provide comment on guidance that was issued by the Centers for Disease Control on the issue of testing. So with that, let me first turn it over to Dr. Sarah Cody.
Good morning. Nice to see everyone. I'm Dr. Sarah Cody, County Health Officer. And I learned yesterday that the Centers for Disease Control had issued revised guidance on their testing, recommendations for testing. Since then, we've had a number of inquiries. So I wanted to come before you today and clarify our county guidelines and our county order regarding testing. Before I do so, I want to say that when I first heard about this change in guidelines, I actually didn't believe it, for it seemed entirely bizarre, in that it undercuts our very basic tenets of how we control an infectious disease. Testing and having individuals know their status is foundational to our ability to control an infectious disease, and certainly our ability to control COVID. So let me start with the new guidance and highlight where our local guidance and in fact our local order is different. The revised guidance says that someone who has mild symptoms may wish to get a test, and a test may be offered. Our local guidance and our order is quite clear that anyone with any symptoms of COVID should be tested right away. This will be particularly important this winter as more respiratory viruses come and circulate. It's very important to know whether your symptoms are because of COVID or something else. Number two, the new CDC guidance says that if you've been in close contact with a confirmed case of COVID, you do not necessarily need a test. This was the part of the guidance that felt, frankly, most bizarre. The truth is that if you've been in contact with someone who is infectious with COVID, you absolutely need to get a test. And in fact, our health officer order requires our healthcare facilities to test contacts. I want to say before I hand this over to Dr. Fenstersheib that testing is our way out of this epidemic. Since the very beginning, testing has been the Achilles heel for our country and for our county in getting us out. When you get a test, you know your status, you know whether you're infectious, and you need that information for two reasons. One, for yourself, to know whether you're going to get more ill and to be able to watch your symptoms. Number two, you need to know whether you pose a risk to your family and your friends and your coworkers so that you can tell them whether they need to be tested. If everyone knows their status, whether they're infectious or not, they can take action. If you're infectious, you isolate. If you're a contact, you quarantine away from others. And that is the way we are going to get ourselves out of this pandemic and return to our lives. That is how we are going to be able to open businesses, open activities, and most importantly, that is how we are going to get our children back in the classroom where they can best learn. It's through testing. It's through knowing your status. It's absolutely foundational. And so here in our county, in the County of Santa Clara, We are going to continue to work with all of our healthcare partners to ensure that they offer testing to the groups that need it. And we, through our county health system, are going to continue to offer mass testing at several sites as often and as robustly as we can for as long as it takes. Thank you.
Leading up the testing task force, and we have really done, I think, a tremendous job with our team, with the help of those around the county, in increasing the capacity of testing in our county. We have gone from doing 1,000 tests a day to now upwards of 6,000 to 8,000 tests a day. It's very critical to realize that 35 to 40% of people who are infected may be totally asymptomatic, meaning without any symptoms, and so you wouldn't know that they were infected. If we don't test those people who are most likely contacts to someone else who was infected, if we don't test them, we will not know that they were infected. If we don't know that they're infected, they will then infect others, their family, their friends, their coworkers, and that is critical. Testing is very, very important, especially to the contacts. We need to follow the science, and that's the science. And everyone agrees that has a science background, that testing is critical. I respect the CDC, have always done that through my career. However, I believe that these changes in the testing guidance have not come from the CDC directly. I believe that these changes in the guidance have come from further up the chain in the federal government, from the White House, and they are misdirected. They are totally misdirected. Failing to test is not going to end this pandemic. Failing to test will not make the virus go away. Lacking a strong testing program, I think, nationally has been one of the largest failures of our federal government. However, we will not change our guidance because of this. We will continue to have a strong basis in science. We will continue to encourage people to be tested so that we can contain this pandemic. And so I urge people, again, if you are asymptomatic, get tested. If you are a contact to anyone, get tested. And if you are a frontline worker, get tested. We have plenty of testing sites on our website. The fairgrounds has recently been open. We have the capacity of testing over 1,000 people there a day. So people, please take advantage of the testing in this community. Thank you.
Thank you, Dr. Cody. Thank you, Dr. Fenstersheib. We're happy to take a couple of questions.
Question for Dr. Cody. As you know, that the San Jose Earthquakes are having their first sporting event here in the county later today, and then Levi Stadium is going to be hosting football games, although without fans, both venues without fans. Can you talk about the ability for the county to now allow these types of sporting events?
So for those on Facebook Live, they're asking about the sporting events, a couple of sporting events that are happening in the county. Dr. Cody?
Actually, Dr. Fenstersheib has been, I might refer this to Dr. Fenstersheib, he's been working with sports teams to ensure the safety for the teams and for the community. And I don't know, Dr. Marty, if you have any particular comments. I don't have any particular comments on this.
I could just say a couple of things, and again, I've been in consultation with Dr. Cody, the health officer. We have been working with the professional teams and realizing the issues of them wanting to play and the need, but also realizing the critical nature of making sure that our community stays safe. And so in working with the teams, they have instituted a great deal of testing for their players. And again, we insisted that that testing not take away from resources in this community. So that testing is being done through other resources outside our community. We have insisted that, again, that they follow our guidelines, and that if there are any players who test positive, again, that they are quarantined for the necessary time, as is our recommendation. So we have, as I said, been working with the sports teams, and they have been very compliant with us, and we are keeping in contact with them.
Doctor, is that some indication that things are loosening up a little bit in this county?
No, not at all. Things are not loosening up. We are being as vigilant as always, but again, insisting, again, in working with the sports teams that none of the players will pose any risk to any of the community members, so that they will stay contained within their facility and not have any facing out to our community or any exposure in our community. So that was our number one requirement, that we protect our community from any further exposure.
Thank you. Any other questions? Great. Thank you very much. This concludes our press availability, and we're happy to. I'm happy to take any questions in Spanish after this.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.